So when you look at the current medical model, for the most part, it is pretty much breaking up the body. So for example, if you have a heart issue, you go to a cardiologist. If you've got a bone issue, you go to the bone doctor. If you have some sort of other arthritis, you might go to an endocrinologist. So we go to all of these different doctors, and they're all incredibly siloed and specialized. Even in some of the fields, there are even more specialties within the specialty. So for example, when last year I had a shoulder issue, a hip issue, and a knee issue. And so I went to the shoulder doctor, and it's a big practice, so they have everybody there. So I go to the shoulder doctor and I said, as long as I'm here, my hip is bothering, my knee is bothering me. Do you think that we could talk about those things too, so I don't have to come back? And the doctor said, well, I only see shoulders. And so if you want to come, you have to come back to see just the hip person. And then you're going to have to come back to see just the knee person. So there wasn't even anybody in the practice that looked at the entire skeleton. They broke the body down even into more parts. So, and the problem with that is obviously, in one way, it is just that it's inconvenient for the patient, but also the doctors are not talking to each other. And so you probably see this with some of your clients, that they end up with all these different doctors. And especially as we move into elder care, we have lots of different medications and nobody is talking to each other. The other thing about conventional medicine, is that it's really about naming the issue, blaming the issue, and then taming the issue. So, okay, I have ADHD and I blame that on all the issues I have in terms of my ability to learn or my ability to keep my house. And so I'm going to tame it by taking medication. Maybe I'll do some other things, but we're going to just try and name it, blame it, and then tame it. Now, I want to just pause for a second and just say, I have nothing against conventional medicine. If it wasn't for conventional medicine, I would not be here. I was in this boating accident. I ended up in the emergency room. I ended up actually in ICU for 6 days, and then in inpatient rehab for 2 weeks, and then another 18 months of rehab outside of that. I broke my neck. I broke all of my ribs, and both lungs had collapsed. So if it wasn't for the acute care that I received and for conventional medicine, I would not be sitting here, and I'm positive of that. And my oldest son is an anesthesiologist, so I've lived through him going through medical school, residency, and fellowship. I understand the depth of training that these people have, and it is remarkable, and I am grateful. So when I talk about the medical model, it's not that it's a bad thing, it's just not the whole thing. So they separate the body, and really the body is all about mind, body, and spirit. And so we can't really disconnect. And I really came to understand that when I had my depression, because what I was eating had a tremendous impact at the time when I was a raw foodist on how I was unable to handle the stress in my life and became suicidal and significantly depressed. So the medical model is great for acute care. It's not great for long-term health care, like really and truly taking care of our health. So the answer to what does take care of healthcare is functional medicine. And functional medicine is a personalized, system-oriented model. It is predictive, it's preventative, personalized, and participatory, meaning that it helps us to look into the future and see what the body might do. It is looking at what can we do from a supplement standpoint, sleep, exercise, community, that can help us to prevent things from occurring. So for example, somebody has the ApoE4 gene, which means they might be at higher risk for Alzheimer's, but that doesn't mean they're going to have Alzheimer's, because we can do things to help to mitigate having that gene and whether that gene gets turned on or gets turned off. So it's predictive, it's preventative, it's personalized. So that means that each person's treatment plan is going to be different than the next. And this is important, and it's key to the fact that when it comes to mental health, and anything for that matter, any kind of health issues, we are each of us different. There's certainly some things that are the same across the board in terms of an age group or a particular race and the genetic makeup of those of people. But in terms of each of us individually, think about the people that come into your office. Think about maybe the last couple of days of people that came in who had anxiety or depression or ADHD or whatever other diagnoses you might have experienced. Can you honestly say that every single one of them is the same? Can you say that every single person's depression is the same or their anxiety is the same? Of course not, because some people, their depression maybe is caused by a life event, like maybe they're getting divorced or maybe they've just experienced a significant loss. But for somebody else, maybe they've just had a lot of trauma in their life and they've never learned how to feel any kind of joy, that they have this learned helplessness and this sadness about them. And the same with anxiety. Maybe anxiety was caused by something that is coming up, something that's pending, there's a big speech coming up or they have a test to take. So they're anxious, or they have to fly on a plane and they don't like to fly. So maybe they're anxious about something that's about to happen. Or maybe they just have this sort of anxiety about life in general. But every single one of them and every single one of us experiences all of these things in a different way. So we want to, in functional medicine, we want to acknowledge that, and we want to try and figure out what's different. And then it's participatory. And that means that every single person gets to participate in their health. So when you go to a conventional doctor, so I'll give you, I have a couple of examples in my own life. So I've been having some GI issues and I've had them on and off my whole life, but they got particularly bad last fall to the point where my stomach was hurting all the time, no matter what I ate. I couldn't figure out what to eat, what not to eat. Nothing worked. It's really hard to diagnose yourself. And so I went to a functional doctor, and she's a friend. And so I didn't actually see her in the office. We just sort of in passing, she said, well, it sounds like this, try this. So she gave me some food to take, a powder that's called a medical food. It's a powder. It's mostly amino acids, proteins, fiber, some vitamins. She said, start taking that. And if it doesn't work, then come back and, we'll talk some more. So I felt better, but then it got worse again. So I decided that, I want to make sure that there's nothing physically wrong, like a tumor or, something serious that I need to physically check. And so I made an appointment with a conventional doctor, a GI doc. And so I had that appointment in January. And so when I went to him, he asked me a bunch of questions and he quickly came up with some theories. And he said, I want you to get an ultrasound. We're going to do some blood work. And I want you to start taking this antibiotic. And I said, well, I'm also taking this medical food and I'm taking this probiotic. Do you want to look at those and at least see what I'm already doing? And he said, no, I don't. He said, in fact, I don't even want you to take that. I want you to discontinue those things and do this instead. So long story short, I did end up back at the functional doctor who the GI doc wanted me to do a few things and come back in 6 weeks. The functional doctor had me do some significant testing and then made a diagnosis based on the testing and has me doing things for the rest of this year, not just 6 weeks, but for the rest of this year. I am taking specific supplements. I'm taking specific medical food, probiotics, and she wants me to do it through December. So I am now in charge of my health. So I am participating where the GI doctor was relatively dismissive and just said, do these things and come back. So functional medicine is about a collaborative relationship with whoever your doctor might be. So I want to give you another example of the difference between conventional um, and functional medicine. So another one of my stories, because I'm 63, I'm postmenopausal. And so I'm on hormone replacement therapy, or HRT. And so when I go to I go to a regular OB/GYN. She's not a functional doctor, but she practices in a more functional way. And so she will take my blood every 6 months, and then she checks it, and she prescribes hormones for me at a compound pharmacy, which means that my HRT is completely different than anyone else's on the planet, because it's based specifically on my blood work. So when I went to Kaiser, because I had to go to Kaiser a couple of years ago as my healthcare providers, I was meeting with the doctor, and he was putting my chart together. It was an intake. And he was typing away, asking me a bunch of questions. And then he said to me, "So are you on any medication?" And I said, "Yes, I'm on HRT." And he said, "Well, what's the dose that you take?" And I told him, and he stopped and he said, "I don't have that in my system." And I said, "Well, that's because it's mine." And he said, "Oh, well, I don't even have any way to put this into the system." So because Kaiser is an HMO, they have their own pharmacy. And that means that they aggregate their medication for things like HRT, meaning when you're a 50 to 55-year-old woman with this particular blood work, you're going to take this medication. If you're 56 to 60, you're going to take this medication, and so on. And that's how they record it, that he just had these very specific choices. But for me, it was completely mine, and he had no way, he didn't even have a field to enter it in. So that's the difference between a conventional doctor and a functional doctor. The conventional medicine is going to aggregate us. They're going to do some research, and they're just going to say, because in the study, all these people responded this way, so this is how we're going to treat everybody. And that probably works for most people, but we all have our individual nuances, and functional medicine wants us to look at that.